Hi, counselors. I just finished editing this core function number 5, treatment planning, and realized there's a couple things I want to say. First off, this is only for coaching. This is not a CEU class. I am not teaching you how to treatment plan. I'm simply trying to coach you on how to approach the IC&RC and the NADAC exam so that you can pass it. So nothing in this video is meant to teach you how to actually do treatment planning. In no way do I want to represent that it is. All I'm trying to do is coach you on how to think about it and approach it when you're taking a counseling exam. Other than that, let's get going. Hi, counselors. Welcome back to LeeBella Coaching and Counseling. I'm Scott Spiers, licensed clinical addiction specialist and clinical supervisor in North Carolina. And this is core function number 5. Now, if you spent any time in the field, you have been bombarded with information on treatment planning, and a lot of it is contradictory. In fact, the number one area of people I've been working with so far that they've had difficulty in the 4 domains of the IC&RC exam is in treatment planning. There's a couple things to keep in mind is you want to simplify your understanding of this core function. Different insurance companies, different facilities, different states, the feds, the modality, all these things can influence the treatment planning that you're actually doing at your facility. You want to kind of honor that experience and use it for confidence, but at the same time, simplify things a little bit. So let's look at what treatment planning actually is. So it is the process by which the counselor and the client identify and rank problems needing resolution, establish agreed upon immediate and long-term goals, and decide upon a treatment process and the resources to be utilized. So one of the perspectives in most counseling exams is a client-centered approach. So when you're taking one of these exams, you want to get out of your head that Medicaid, for example, is going to mandate these things go onto the treatment plan. Let go of the insurance requirement that anything in the note and in the session has to relate directly to the treatment plan. It's true, but just not to the extreme that you're going to encounter in real life. So it's from a patient-centered or client-centered perspective. Also, the biopsychosocial model plays a big part in treatment planning and the way that they word the questions on the exam. So let's take a moment and break down the global criteria one at a time. The first global criteria is to explain the assessment results to the client in an understandable manner. Okay, this is a key element to the process, and it's very similar to the assessment. You wanted to explain the rationale behind the assessment. You always want to be explaining to the client what it is they're going to be doing, why they're doing it, and answer any questions they have about the process. And this is important for us as counselors because it builds rapport. Keep in mind that that client has known you for maybe 10 minutes. And you just ask some questions that are going to be uncomfortable, and they're going to give you answers to those questions they've probably never given to anybody before. So when it comes to treatment planning, you want to take every opportunity to make sure that they don't feel that they're part of the process. You want to make sure that they are part of the process. This also facilitates informed consent. Keep in mind, your client needs to always approve, right? Be informed of what it is you're doing. So take a little bit of extra, trust me on this one. If you struggle with how long it's taking you to do treatment plans, part of the thing could be your client doesn't understand what the process is. Finally, explaining the assessment results, it forms the basis of a collaborative and client-centered treatment plan. So those are the key things for that global criteria. Next up, and here's where things get interesting on treatment planning on the exam. You identify and rank problems based on individual client needs in the written treatment plan. Keep in mind, the patient's identified needs are going to have priority here. Also, while needs is in this global criteria, don't forget about strengths, weaknesses, problems, and of course needs for the development of the treatment plan. Keep in mind that your treatment plan, but a lot of places you're going to hear we have a strength-based treatment plan. So we'll get to that. You can use their strengths in methods. You can use their strengths in short-term goals, but I'm getting ahead of myself a little bit. So in client-centered treatment planning, the patient pretty much determines the rank. However, let's keep it real. Insurance companies, state requirements, and facility policies may mandate that the drug of abuse be ranked number one. Okay? One concept that, if you can grasp this, will help you on your career is whoever is paying for the treatment dictates the treatment plan. For example, if you have Blue Cross Blue Shield, Aetna, or insurance, your treatment plan needs to conform with how they view the treatment plan to be. Medicaid is the biggest one on this. They call it a patient-centered treatment plan, but good gosh, there are each Medicaid provider, each Medicaid, I don't know, there's 1,000 Medicaid things out there. Each one have their own particular slant on this. And, if they report they have a toothache, they're going to want that to be on the treatment plan along with the referral to their dentist, primary care. Strip all that away. Okay, that's the real world. When we're doing core function prep on treatment planning within the exam, keep it relatively simple, keep it within the core function itself and the global criteria. Let's move on to the next one. Next global criteria is formulate agreed upon immediate and long-term goals using behavioral terms in the written treatment plan. Again, pay attention to the word collaborative. You are agreeing upon these goals, therefore you are collaborating. And here's where things can get a little bit confusing. So let's take a typical client for alcohol abuse or dependence. When you're working with the person initially, the long-term plan might be to abstain from alcohol within 90 days. And true, if they're inpatient, they're going to abstain like right away. But pay attention to your questions, pay attention to the reference. Typically, if you're following stages of change theory, which we will get to in another video, that's pre-contemplation, contemplation, preparation, action, maintenance, relapse, and exit. From that point of view, you want to give them time. So, hey, three months from now, abstaining from all alcohol. The short-term goal could be reduce alcohol from 6 to 4 drinks per day within 2 weeks. Got to warn you though, if you do that, if you're setting that in a lot of electronic health records and stuff, it means you need to update the treatment plan. I like to look at it as you have an opportunity to update the treatment plan. So long range goals tend to be 90 days. Treatment plans, most insurance companies, again, Medicaid, all of them, it's going to be a 90-day treatment plan. Your facility might mandate a 30-day update. A lot of patients in methadone treatment, their initial treatment plan expires in 30 days. Don't let all of that cloud your judgment. long-term goal tends to be 90 days. Short-term goal tends to be less than 90 days. One other thing, you must have an updated treatment plan in order to provide services. If you are providing counseling and the treatment plan has expired, then you are not following best practices and you're no longer in compliance. Here's something, and I'm surprised how many people aren't aware of this. This is where we get to what are called SMART goals. So any goal that you have in the treatment plan, you want it to be specific, measurable, achievable, relevant, and time-based. So within 90 days, time-based, abstain from alcohol. Okay? So it is specific, it is measurable, you can actually measure zero, and it's time-based. And then something like reduce alcohol consumption from 6 to 4 drinks over the next 2 weeks. Again, specific, measurable, achievable, relevant, and time-based. So SMART goals. If there's one thing you want to write down on that piece of paper with this core function, it's SMART goals. Remember, keep to the fundamentals in the exam. Always rely on the fundamentals, not so much your personal experience, but what the best practices and what the theory kind of suggests. Be mindful of the information gathered in screening, intake, and assessment. And I'll keep saying it, make sure that your goals, long-term and short-term, are specific, measurable, achievable, relevant, and time-based. Next up, we have identify the treatment methods and resources to be utilized as appropriate for the individual client. All of these things you have been identifying since intake. Another word for treatment methods are counselor interventions. Now, methods refers to specific counseling approaches such as cognitive behavioral, 12-step facilitation, motivational enhancement. And within cognitive behavioral, it would be your method would be referring to homework, journal prompts, things like that. So when it comes to methods, keep in mind, methods relates to counselor intervention. Intervention means what therapeutic technique are you using? Cognitive behavioral, 12-step, homework, and referrals. Resources can be things like individual and group counseling, 12-step meetings, primary care doctor, support groups, and any services that are going to be available in your community. So this is a tough one, and I have to admit, I struggled because there's so much in treatment planning, and it's really easy to get bombarded. Keep in mind what the core function says. Keep in mind what the different global criteria are. Keep in mind SMART goals. Keep in mind that this is collaborative. Remember, long-term, 90 days-ish, short-term, a few days to a couple months, and then method, how are they going to do this? So that's it for treatment planning, at least for now. If you have any questions, please leave me comments. And of course, I am available for individual consultation on exam prep. Just get in touch with me. I'll have the link pinned in the comments. I'll have the link in the description. And hopefully this is really helpful. Just keep it a little bit simple on this core function. You're probably going to be okay. Until next time, this is Scott saying, good luck, counselors. See you next time.